Hi, I'm Janine, a former case manager.
And I'm Truck, a former social worker.
We are currently psychiatric nurses, but we remember what it's like to work in community mental health without a background in neurobiology or pharmacology.
Our goal is to help case managers and social workers better understand what their clients are experiencing so that they feel competent and confident that they can meet the needs of their community mental health clients.
This module discusses the neurobiology and treatment of bipolar disorder, also known as manic depressive illness. Before we begin, we believe that you'll have the best learning experience by downloading the guided note sheet while following along with this presentation. The link to the note sheet is just below.
It is important to note that there is great variability in the way that mood disorders present, which is one of the reasons why it can be difficult to effectively diagnose and treat them. One end or one pole of bipolar disorder is depression, often characterized by low energy, unshakable sadness, and thoughts of ending one's life. When depressed, clients may also experience marked changes in appetite or sleep pattern, either too much or too little. The other pole, referred to as mania, is typically characterized by high energy, decreased need for sleep, and irritability or euphoria. During manic episodes, people may become more talkative and more social than usual, and may get into trouble because of being hypersexual or spending a large amount of money. In the most severe cases, it's often common for patients to become psychotic, including hearing voices or experiencing delusions. A less severe form of mania is called hypomania, which still involves psychosocial impairments but to a lesser degree. As a result, patients with hypomania are not typically hospitalized.
The most current research indicates that factors from both genetic and environmental origins influence the development of mood disorders. For example, a person is born with multiple inherited genes, which put them at risk for a mood disorder. If the person does not encounter significant stressors, they do not develop the disorder. However, stressful environments can trigger changes in vulnerable genes, causing mood disorders, including bipolar disorder, to develop.
Depression and mania are both believed to be the result of a dysregulated brain signaling process. The brain uses chemical signals called neurotransmitters to send messages from one brain cell or neuron down to another. Neurotransmitters most involved in depression and mania include dopamine, serotonin, norepinephrine, and glutamate.
When these neurotransmitters fit into matching receptors on a neuron, the neuron sends a message down a long arm or axon. The speed and clarity of the message moving along the axon depends on the flow of tiny molecules called ions. As the message reaches the end of the axon, it signals more neurotransmitters to be released, prompting more messages to be sent.
Symptoms of bipolar disorder occurs when neurotransmitters, receptors, or ions are malfunctioning. There may be too many or too few neurotransmitters released. The receptors might be misshapen and don't allow neurotransmitters to attach. Lastly, ions may not flow smoothly along the axon. Signals that are too slow, too fast, or too scrambled can change the way the entire message system works.
Many of the medications for bipolar disorder ensure a healthy ion flow, which ensures that messages are clear. One group of these medications is referred to as anticonvulsants because they commonly are used to prevent seizures and also have been shown to have mood-stabilizing properties. Drugs in this class include Depakote, Lamictal, and Tegretol. While the exact function of these drugs varies, their common characteristic is that they ensure that there are the right kind and number of ions to keep the message clear as it moves from neuron to neuron.
Side effects of anticonvulsant mood stabilizers vary but often involve sedation, cognitive impairment, gastrointestinal complaints, and weight gain. Most of them requires blood monitoring to make sure that the dose is right and the blood cell counts are normal. Because of the risk of causing birth defect, these medicines in particular need to be used with great caution in women who are capable of becoming pregnant.
If your client has difficulty following through with appointments or is forgetful, it may be an important part of your work together to make sure that the patient gets the blood work done. It is important for patients to keep an eye out for rashes, as some anticonvulsants, especially lamotrigine or Lamictal, can cause dangerous rashes. These rashes are often on the chest or arms and may have a pinprick pattern or peel. It is considered to be a medical emergency if your patient has a rash. Assist them in getting in to see their provider or go to the emergency room. Help your client contact their provider with any concerns about side effects.
Lithium is considered to be a classic mood stabilizer. Lithium is an ion which can be found in nature, similar to sodium. Lithium is slowly absorbed into brain tissues where it helps regulate message movement along neuronal axons. While lithium can be very effective, it is one of the more high-maintenance medication, and it is important that these patients understand the following teaching points.
Lithium has what is called a therapeutic range, meaning that if there is too little of it in the body, it's not effective, whereas when there's too much in the body, the patient can become toxic or even die. As a result, lithium levels are carefully monitored through periodic blood draws.
When working with a client who is taking lithium, it's important to remind them to always stay well hydrated because dehydration can cause the lithium level to climb into the toxic range. It is especially important to remain hydrated with illnesses that cause diarrhea or vomiting or when sweating a lot during exercise. In general, at least 2 liters of fluid intake a day is recommended.
Because lithium is removed from the body through the kidneys, and because many drugs affect the kidneys and can affect lithium levels, it is critically important that the prescriber is made aware of all of the medications, both prescribed and over-the-counter, that the client is taking and any changes in these medications. Common medications known to affect lithium levels include blood pressure medications and pain medications like ibuprofen.
Side effects from lithium which are more common at higher dosages includes a slight hand tremor, increased thirst and urination, weight gain, and not being able to think as clearly as usual. Dry mouth, fatigue, nausea, and diarrhea are also possible. Side effects may decrease after 2 months.
It is important to recognize signs of lithium toxicity early because it's difficult to quickly reverse the toxicity. Signs of toxicity are similar to side effects but are more severe and include an increase in tremor, slurred speech, muscle weakness, and diarrhea. More significant signs include mental confusion and vomiting. This can be a life-threatening emergency, so help your client call their provider immediately or send them to the hospital to have their lithium level checked.
Some antipsychotics, also known as neuroleptics, have a mood-stabilizing property as well and are particularly helpful for patients experiencing mania. Please see our module on psychosis and antipsychotics for a more detailed information.
As alluded to previously, it's important that you encourage female clients who are sexually active to discuss both birth control and mood-stabilizing medication options with their providers. The client and provider will need to discuss the treatment plan based on the likelihood that the patient may become pregnant. Risk profiles of mood-stabilizing medications during pregnancy vary, and there are also risks associated with untreated bipolar disorder during pregnancy. It's really good to plan ahead if you can.
Additional treatment for mood disorders may also include psychotherapy. Identifying stressors and plans to reduce their effects on your client's life can make a huge difference in your client. Creating a quote-unquote mood chart, which tracks the client's mood, recent alcohol or substance use, amount of sleep, and stressors can help the client identify factors which affect the stability of their mood.
Thank you for watching our module on bipolar disorder, created as part of a Masters of Nursing scholarly project through Seattle University. Please check out our other modules on anxiety, depression, ADHD, and psychosis in schizophrenia. Thank you.